Morning friends. आज I would like to speak upon chronic advanced medical renal disease, chronic kidney disease, जहाँ पर patients का we have to understand when the patient is entering into a critical stage and requires immediate medical attention. The three clinical red flag signals which are critical signs one must have to understand as a doctor and patients को भी ये जागरूक होना है कि अगर ये तीन clinical signs देखने को मिल रहे हैं then it is a medical emergency. First of all, the first red signal is that if the patient is having acute shortness of breath. ये shortness of breath होता है because of the fluid overload when there may be pulmonary edema and this edema may actually constrict the heart and lungs basically, which leads to shortness of breath. This is one sign. दूसरा साइन होता है when the potassium levels in the blood increase very high, which is more than 6 millimole per liter. So if that happens, there would be another important understanding that the patient is entering into a critical phase. Third, अगर उसका patient का जो chronic kidney disease का patient है, अगर उसका GFR बहुत low जा रहा है, if it has reduced even less than 15 milliliter per minute, then it is a medical emergency. So, or either creatinine becomes more than 500 millimole per liter, then it is a condition which we have to consider that it is a critical condition. Or there could be the blood pressure, the hypertension, the patient's blood pressure is increasing more than 180 by 100 and the patient is uncomfortable, restless, or there may be confusion or disorientation. जब मेटाबॉलिक एसिडोसिस होता है तो ये कंडीशन ये साइंस देखने को मिलते हैं. सो दीज थ्री क्लिनिकल साइंस वी मस्ट नॉट हैव टू इग्नोर एज अ डॉक्टर एंड द पेशेंट शुड ऑल्सो गेट अवेयर अबाउट दिस. And if we ignore these, the patient may land up into any kind of emergency. And what needs to be acted upon, what action we have to take? The patient should be referred immediately to the nephrologist for immediate medical attention, and an option of dialysis should be explored. It has to be considered, and the patient should have to be closely monitored and managed for uncontrolled hypertension and acidosis or other complications. Thank you very much.